All right, we fixed our technical issues, so let's start the conversation with Dr. Ron Holt, psychiatrist. We've been talking a lot about how it's been so tough for students, teens, uncertainty over the school in the fall or college, making friends and missing milestones like graduation. Are you seeing a big influx of kids and teens saying, hey, I need help?
Yes, absolutely. And you're correct. I mean, the students have gone from an everyday life of being on campus to missing out on so much now, including the loss of face-to-face interactions in class, missing, just social interactions on campus, possibly losing their housing if it was associated with her being on college, and also food insecurity as well. And so a lot of them too, I think as of today, there are 40 million people now that have lost their jobs. And that's been a real big stressor for students as well. And so all those combination of things have caused a lot of stress. And so we're seeing an uptake in the amount of students that are coming in asking for mental health services.
And of course, when you're not in school, Ron, that is one big place where people would either report a problem that they're having themselves, or that teachers or other staff would be able to see a problem to report. So when you don't have that kind of reporting function, that must be a concern.
There's no question about that at all. And so what I encourage students to do is, even though they may not be on campus anymore, or may not be in the dorms or have their social environment, is if they're at home and they're struggling, is to reach out. And reaching out could be to their advisor, it could be to their campus counselor, it could be to the healthcare practitioner. I don't want those students to feel like they're alone. And so if they are struggling, please reach out. There's nothing wrong with reaching out, and it's okay to not be okay.
Ron, as a parent, what are some of the signs that I can look out for, behavioral changes?
So that's a great question. And so for a lot of us, it's normal to have just kind of some normal fear around not knowing the future. However, for some people, it goes a step further, and it can start going into symptoms of depression. And so if you start noticing symptoms in your child or student, such as problems with sleep, either sleeping too much or not sleeping enough, problems with interest, that is an issue as well. Feelings of guilt, if they have problems with feeling energy level being low, problems with concentration and memory, those aren't as good as well. And also occasionally, students can have thoughts of being better off not alive. And so if you start noticing some of those symptoms in your student or your kid, like maybe they're not getting out of bed, or they're not as motivated, or they're not interested in going to school, it's definitely time to reach out to them and say, hey, I've noticed some changes in you. Why don't we go ahead and reach out to someone and see if we can get you some help? Because I think what we need to do is normalize how they're feeling and say, yes, this is something that is real, and we're all going through this, and there's nothing wrong with getting help that you might need.
And Ron, we just have a few seconds left, but finally, what are some coping mechanisms that a young person could do if it isn't so extreme to be hospitalized or need a doctor's attention?
So, I mean, just coping mechanisms that a person could do is just like, have like a regular sleep pattern where you go to bed and get up at the same time each day, and end up going out for a walk each day while practicing social distancing. Also picking up the phone and reaching out to your friends and family, or doing a video chat, or doing a Zoom call. Problems, things like that can actually make a huge difference. And also, I think just having a normal routine. So instead of getting up each day and doing things like you normally would, so that we don't fall into this fatigue of just staying in our pajamas all day.
Right. Schedule is so important, even if it's a
no question.
Schedule.
All
Yeah.
right. Dr.
Ron Holt, we appreciate it.
Thank you so much.
Thank you so much. Okay, take care.